Yeah, there's a whole host of manual therapy techniques that physical therapists, chiropractors, and osteopathic physicians perform to the patients, depending on the severity of the arthritis. You can go to the Hip Track YouTube channel and the website, and you can see some of those demonstrations. The first and most widely used technique is called long axis hip traction. I mean, basically the person's lying down in a certain angle, the provider is going to pull on their leg to distract their hip. It provides so much relief immediately for that patient. You know, oftentimes they joke a lot, like, you got to come home with me. You know, my wife, my husband, my whatever, they won't help me with this. You know, or they're too tired. And it gives them so much relief, because when you're standing on that sore hip, it just makes you not want to get involved or get active with anything. It just really hurts. And so when someone decompresses that, it just gives them so much relief. And so people say, well, you know, it feels good while you're doing it, but as soon as you stop, then the pain comes right back. And we say, you know, absolutely. So you have to, manual therapy really works. It works much like antibiotics would work, you know, if it was treating an infection. Doing it once for 5 minutes really has no little effect. Just like taking one antibiotic pill wouldn't really do anything for your infection. Your medical doctor will tell you, well, you have to take the antibiotic, you know, twice a day for 10 days. You have to be consistent in order to get on top of that infection. Well, manual therapy is very similar, that we want that patient in the beginning coming into the clinic once or twice a week regularly for 3 to 6 weeks. And as you kind of improve that mobility, it'll want to rebound back, and then you'll improve a little bit more, it'll rebound back, and then you can kind of accumulate the effects of that manual therapy to maintain that joint capsule mobility and get that joint moving better. There are just a lot of techniques. You start with the pain relieving ones, and then you'll work more aggressive, more specific techniques as you go, depending on the situation with that patient.